All right, all right. So, welcome to the Your Podcast Mentor Show. Hanging out with Dr. Smith, the host of the Empowering New Nurses podcast. We're at Podcast Movement 2022 in Dallas, Texas. Dr. Smith, how are you doing?
This is great. I'm excited. Wow, this podcast movement is just unheard of. It's almost incredible. I've learned so much. I've seen so many people from all over the world.
Yeah.
I think this is awesome. And you being my mentor, wow, wow.
Okay, look.
Thank you, thank you.
Yeah. Well, I'm grateful because I didn't tell you this, didn't tell RJ, didn't tell nobody this really, but it's pretty cool though when to see you develop a community of people. And then you get to see them in person, like me meeting Dr. Burgess, me getting to meet you in person, you know, me meeting Joanna, she's a part of this community too. and then RJ. But look, let's dive straight in. Let's talk about you. So you are the host of the Empowering New Nurses podcast.
Certainly.
Right, and you've put out what? How many episodes you put out at this point?
I've put out about 30 episodes at this point.
Okay.
I started about 5 months ago.
Yeah.
Yeah, and when I started, I was like, I told you this before, that YouTube, I just looked for information, for content, and WhatsApp and my email, that was about it. But now I've heard different terminologies, I'm using some of them, and thanks to you guys. And I'm happy I joined this. This is just phenomenal.
Yeah.
This movement, this podcasting, wow. Unbelievable.
Yeah, I mean, it's one thing, because I was talking about this earlier, one thing I like about podcasts is because depending on what your passion is, an area of expertise, you have the opportunity to be able to empower people, right, in your respective arena. So when you decide to start the Empowering New Nurses podcast, like, who is the person that you want to hear this, and why do they need to hear it now?
You mean my target audience?
Yeah.
Definitely. These are young nurses who have done the NCLEX, they have done the theoretical part of it, but they have not yet gotten the experience in the clinical setting. And therefore, because I have been an educator, nurse educator for many years, I have seen the gaps, I've seen the need for this. I've seen the need because many times a young nurse is scared, very fearful, fear of the unknown, not sure of what's happening, fear of asking questions, fear of making any error. And so that can be very burdensome sometimes because the work itself, nursing, can be overwhelming. It's a very rewarding profession, but there are times it can really be challenging, especially now. We have the baby boomers like myself and others some nurses have come on and they have left the profession because they didn't know that it would have been so challenging.
So what would you say is one of the most challenging things that a new nurse faces?
The new nurses fears making any error and asking questions. These are and they become anxious, not knowing what assignment they will get, or not knowing how the preceptor they don't want to ask questions that they might feel dumb. So they can be very anxious about that. And of course, they don't want to make mistakes. And at the same time, sometimes some of the preceptors are not as, you would say, as helpful.
Okay.
Some preceptors are not as helpful to that particular. Are they not aligning or they don't match? And that happens sometimes. Therefore, I usually say to those nurses who have found that they're uncomfortable to let us know, or let me know, or let the other individuals know. But in a tactful way, we would approach the preceptor. And if they're just not a good match, we have to switch them.
Wow. So the people that are supposed to be helping and assisting these new nurses who are coming in, like the new age, the new school, some of these people they don't match, and sometimes they're not as helpful as one should expect.
Exactly, because some people, some preceptors or some older nurses, they think that because it can be challenging, they might be working short, and they then have to divide their time to teach. And there's some factors that definitely can contribute to them acting that way. Sometimes they're overworked, sometimes they're tired. But you have and sometimes they have their patients, plus they have the student or the orientee to share their experience, their expertise, and some of them might not feel as fulfilled, and some might just tell us as an educator, I won't be doing it. I'm not interested in being a preceptor.
Wow.
So that happens, and that happens.
Wow. So why? So knowing this information, and then you even connecting with former students, you connecting even with individuals who just know you by way of the field. So why was it that you said you need to do a podcast about this thing? Because I mean, you could have wrote a blog, you could have wrote the book. I know it's coming. I know it's coming. You could have did the blog, could did the book, could did all these other things. Why did you say I need to do a podcast on this?
Well, guess what? It's definitely, I want my nurses to be aware of this, be aware that there's need and there's help. And the help that will be there, I'll be able to contribute to them being more, be an advocate, be more knowledgeable. And I personally share a lot of tips from my personal experience over 40 years of nursing. So I have been in nursing when I was very young. And I've grown through. A matter of fact, I was recruited to this country as a critical care nurse from Jamaica, West Indies. And I've furthered my education from being a BSN to an MSN with certifications, both in critical care and in maternal nursing, in the sense of clinical consultant, clinical, I would say counselor, lactation counselor. So I have the experience of teaching young nurses and also parents and mothers in terms of breastfeeding.
How difficult was it for you to leave your home country, to leave where you were born, and then to come over here? Because you said you were recruited.
Yes.
So how difficult was it, and ultimately why did you decide to come over on this side versus staying out in Jamaica where you were, where it's beautiful?
Beautiful country. I mean, beautiful island, beautiful people, and food and all of that stuff. But, there are times when financially it's challenging and the pay was not like if you should convert to like Jamaica and here. But the quality of life has been good. At the same time, everybody wants to have more money, let's put it that way, and have a different lifestyle. So I was given the opportunity to gain more money, to come here, gain experience in America, brought some of my experience that I had in Jamaica here, and utilize and implement my care, share my knowledge, and not just but I would say a diverse group more than what I had home.
Okay.
But I had experience from home over 7 years home before I came here.
Oh, wow.
Yeah, so I was a critical care nurse. I was a preceptor in Jamaica. I did nursing in different areas, in critical care, in med-surg, in ophthalmology, in orthopedics. I did all of that, of course, and in charge sometimes of other nurses. So therefore, I've taken from Jamaica knowledge, expertise to America, which has given me America a wider experience because I cared for people from different arenas. I've cared for individuals. Nursing care is for everybody, high quality care for everybody. However, I've cared for people who have been very influential VIPs. When I say VIPs, I'm not saying better than, I'm just saying in terms of the work that they performed.
Okay.
From clinical care and so forth. So it has been a journey, but very interesting. And I've gotten the opportunity here where I cared for in academia. I taught in academia. And seeing students growing from just coming on board, having no idea even to take a temperature, you got to start right from basics, from fundamental, until the point of where I've seen my student looking at me and saying, I'm now a practitioner, and so forth. And that I'm able to read an EKG, and I'm comfortable I don't know it all, but I'm so much more comfortable than when I started. You know, so these are some inner satisfactions that I've received from when I've seen the progress of my nurses.
Okay, let me ask you this. I'm glad you said academia, and I'm glad you talked about the previous students. Let's say that there is a student, let's say a high school student, who feels that they potentially might have an interest in wanting to learn more about nursing and might want to go down that route. What are some things that you would, like, if you gave them like 3 tips, what would be 3 tips for them to be able to say, I should learn more about nursing? We'll stop there.
Well, listen, thanks for asking that question, because I've had the opportunity of going to a high school and do a presentation, and that was actually helping the college advisor, giving the opportunity to students who would like to be nurses, and therefore they were able, the subject matter, how passionate are they, how do they like caring for do they like caring for others, being empathetic, you know, and of course some grades behind that, not just not just liking, but and more or less having the attitude, the right mindset that they want to pursue that course, and if it's even difficult, they would challenge it, you know. So these are some of the factors, these are some of the pointers, and of course you must have an interest, you must have the grade, and of course research the subject, research it and see. And some individuals, young people, they're concerned about the money, but it's not just the monetary part of it, but they tend to say that nurses work a lot of money, so they go into it. Unfortunately, I've heard with my own ears, nurses, like a practitioner, saying, I'm in it for the money.
Wow.
To me, that was saddened, but the person was transparent.
That's fair. Okay, so you said they want to make sure that they're empathetic, you know, want to make sure that they have that empathetic bone in their body.
Wanting to help.
Yeah, okay, so empathetic and have a heart to help. They also have a heart to, you know, like for people, a heart like to serve. And then the other part you said was making sure that they do their research. And you said the money sometimes is, you know, that's what some people say.
Yes.
That's what some people say. But I'm glad you said that about the research, because I think too often we might see a nurse and they might have a nice car, they might have a nice house or whatever, but if you do the research, then you'll learn about some of these 12-hour shifts.
Yes,
right?
Definitely.
And learn about, you know, you working so many days in the week, and it's like
12 hours sometimes, and you might be on call. So there are many factors and hard work. And you need to get rest, self-care, and all of that stuff. Not just the money, because if you do get in all the money and they don't have any use to yourself after some point, because you should have self-care and you should be temperate also. It's very important, because the long hours can drain you, and at the same time you're not sure what the assignment tomorrow might be, so you should be rested before going to work.
Wow, Dr. Smith, we need 3 self-care tips for nurses. We need it from you. We need it from you. Talk to us. What are 3 self-care tips a nurse who is currently, if they're currently, you know, they're currently at a practice or wherever, just what are 3 self-care tips?
Take care of yourself. Make sure you get some rest before you go to work.
Okay.
Emotional, get some stability, do some exercises. All those are important. Take care of yourself. Make sure you get rest before you go to work. I can't emphasize that more, because if you go to work tired, you won't be able to be effective in giving effective care or quality. And I always say high quality nursing care. It doesn't come like that, because you have to think of the whole person.
Okay.
Okay.
So we say rest. You said do some exercise. What type of exercises are we doing, Dr. We got to give them tangible tips.
Okay.
What
so
type
you
of
can
exercises
take
are we doing?
some deep breathing exercises.
Okay.
That's important. And you can go there for a walk in nature. All those are therapeutic for you. All right. So anything else?
Hey, I was curious. I just want to make sure
make sure you get some rest before you go to work. A mental state. You should go to work with the right attitude. You know, positive attitude, because you might sometimes see patient might start flaring on you as you reach, and you can have other patients who are very, very understanding.
Okay.
But and likewise with the work, you go to work with the right attitude, because somebody might just, as you step on the unit, act out on you. That happens.
Fair enough, yeah.
Right? So there's a mental preparedness.
Okay.
That's needed.
Fair enough, fair enough. And then Dr. Smith, where can people find you? How can they hear your podcast?
Wow, thanks for asking.
Yeah.
The Empowering New Nurses show. I can be found on...
Look at the people, look at the people.
All right, I can be found on YouTube at Miriam Amanda Smith. On Instagram, you can get me on Podcast Mir, Podpal, also Spotify, and Instagram.
Okay, there it is. There it is.
Thanks for asking me these questions, because there are many individuals out there that need to know. Our new nurses, we have many new nurses around, and some of them are scared. Some of them have left the profession because some of them claim that they are bullies in nursing, and they have been bullied and they have left. I've even come into this podcast movement.
Oh, yeah.
I've spoken to different individuals, and I remember one of the participants said to me that his girlfriend left nursing because she was bullied.
Wow.
And that was right here at the podcast fest. So this is, you know, this is very informative, and there's a lot to glean from this.
Yeah,
but I appreciate
definitely.
you interviewing me on your program today.
Yeah, you know, I told you, family. You know, we family. So, you know, I'm grateful for you, grateful for the opportunity, and I'm really excited for you with the Empowering New Nurses show, and really excited about, you know, what you're doing, how you're empowering nurses, helping them, you know, not only just have a smooth integration into the field, but also, you know, making sure that they're doing cultural, competent nursing.
Yes.
They're really setting new mothers up for success with understanding the importance of breastfeeding. Just the content that you've been putting out there, it's been good content.
Thank you. And as you mentioned, culturally congruent care, I'm excited about that, because, you know, the world is diverse. And so each person, whether it's education, whether it's color, whether it's race, whether it's religion, all of those components must be placed in perspective. And therefore, from my culture, someone might cry loudly for pain. Another area of the world, one will just take it easy without saying, as a nurse, you have to be prudent and be able to recognize signs and symptoms to be able to treat that individual or investigate a little more, assess some more, because not everyone will express things. So having those, that concept, knowing that people will react differently to different things, I'll come straight and look in your eyes like that. I'm talking to you in a culture that's being disrespectful. So I have to know who I'm dealing with. Therefore, I would encourage my young nurses to research, because in doing that, that will show respect, that will show that I'm thorough, depending, and they'll be grateful. They will appreciate you for being so expressive and giving individualized care. That's critical. Individualized care, not one fits all.
Yeah, that's good.
Yeah.
That's good. Y'all need to go listen to Dr. Smith's podcast. All right, the Empowering New Nurses show. Make sure to check her out, okay? Podcast Mir on Instagram,
yes.
Podcast Mir on TikTok, but Empowering New Nurses podcast. So go check her out on Apple, Spotify, whichever you prefer to listen, or subscribe to a YouTube channel. Do all three, okay? Do all three.
Thank you.
Yeah,
Thank you.
For sure. But family, this is the Your Podcast Mentor Show. I'm your host, Jonathan Jones, and thanks for rocking. Of course, you all know we talk podcast how-tos, podcast news, and interviews. So until next time, peace, and God bless. RJ, can you just click the end right there? The blue button, far right-hand corner.
Thank you.